Friends, I was discussing about the malaria. I told that malaria means the malaria, that word derived from mal area, bad air. No, it is a communicable disease transmitted from person to person, one person to another person through the bite of female Anopheles mosquito. Male mosquitoes cannot transmit malaria. That aspect I have discussed in detail. Now, how this malaria parasite will be detected? It will be by blood examination only. Simple blood smear examination to diagnose malaria. So, who will take blood smear? The best person to take blood smear may not be doctor, may not be laboratory technician. It is our health worker, male, health worker female. They give house to house visit in the rural area. As I have mentioned repeatedly, 70% of our population in India, they are in the rural area. So our health worker give once in a 15 days, he will give house to house visit and he will ask questions. Anybody suffering from fever? Anybody suffered from fever? Say 15 days back I came, and once again in between these 15 days, in between here, anybody suffered from fever? Any friends or relatives suffering or suffered from fever? If the answer is yes, he will take thick and thin smear on the same slide, and he will give presumed treatment. What is presumed treatment? He will presume that it is a case of malaria and he will give, because it is a case of fever, that the person who is suffering from a fever may be malaria, may not be malaria, may be typhoid, may be COVID also nowadays, may be tuberculosis, anything. But he will presume it is a case of malaria and he will give presumed treatment. Then he will label it, he will note down the details in the book, and then he will submit the slides to the laboratory technician in the laboratory in the primary health center. In the primary health center, the laboratory technician, he will stain it by JSB, just one seeing butter charge technique, and he will, within no time, he will be in a position to examine the slide and to say that it is positive or negative, and if it is positive, what is the species. The different species also yesterday I have mentioned in my previous program, Plasmodium vivax, Plasmodium falciparum, these two. Plasmodium vivax almost 60-70%, Plasmodium falciparum 20 to 25%, mixed infection 8 to 10%, Plasmodium malaria only 1%, Plasmodium ovale not reported in India, but according to the newspaper information in Trivandrum, there was a case of malaria and it was Plasmodium ovale, and it has to be confirmed. Friends, this is in brief about how our laboratory technician will diagnose, because how to control, that I am going to inform. How to control malaria. We should not continue to suffer from malaria. So how to control malaria, I am going to discuss in my next program. Thank you.